Healthcare Administration and Principles of Healthcare Administration. This presentation is about administration, an important field that focuses on managing hospitals, clinics, and other healthcare organizations. Here, we will explore what healthcare administration is, the role of administrators, and how the field has evolved, and also key management principles that guides it. This presentation is prepared by trainee social worker Elizabeth Jones as part of the course academics. Introduction. Healthcare administration is also called as health or medical administration. It involves overseeing the management and organization of healthcare systems. It combines knowledge from health policy, business management, and science to make sure resources are used efficiently. The main purpose of healthcare administration is to improve the quality of the healthcare delivery by ensuring that hospitals and healthcare organizations are well organized, financially stable, and focused on patient centered care. Role of healthcare administrators. Healthcare administrators plays crucial role in running the healthcare organizations. They oversee business strategies in hospitals and clinics, manage physical and human resources, ensure policies align with patient care goals, promote efficiency, ethics, and quality within the healthcare system. So, they're responsible for developing and implementing business strategies, managing the financial and human resources, and ensure that all policies and practice support the best possible patient care. The leadership ensures that hospitals and clinics run smoothly and deliver safe, effective care. Evolution of healthcare administration. The field of healthcare administration has changed significantly over time. In the early 1900s, the wealthy people received medical care at home, where hospitals mainly treated for poor. However, medicine advanced with discoveries like anesthesia, surgery, and antibiotics. Hospitals becomes major centers for healing. Between the 1875 and 1925, the number of US hospitals grew from 170 to 7,000, and the hospital beds increased from 35,000 to more than 8 lakh. Early administrators were mostly nurses serving as hospital superintendents. The first training program for hospital administration began in 1916, and in 1934, the University of Chicago launched the first graduate program in this field. Growth and education accreditation. As healthcare became more complex, education and accreditation in healthcare administration also expanded. The first book on hospital administration was published in 1929. Between the 1940s and 1960s, many universities introduced specialized programs to train the future administrators. In 1968, the Commission on Accreditation of Healthcare Management Education, CAHME, was created to ensure that the educational programs met high standards. This organization was supported by major healthcare bodies like American College of Healthcare Services, the American Hospital Administration, and the American Public Health Association. We're going to the principles of healthcare administration. The healthcare administration is guided by several management principles, and it is developed by Henry Fayol. These principles help administrators create effective system and teams. The first set of principles focus on the structure and relationship. Unity of command means each employee should report to only one supervisor to prevent confusion and conflict. Second, theory of equity emphasizes the fairness and kindness in dealing with staff. Then, esprit de corps. It encourages teamwork and high morale, division of work. It promotes specialization so employees can become skilled and efficient in their task. Authority and responsibility. Here, the authority responsibility must go in hand. Leaders should have the authority to make decisions but also be accountable for the outcomes. The next principle is discipline. It ensures that employees follow rules and maintain respect in the workplace. Then, unity of direction means all activities should aim towards one common goal. Then, remuneration highlights the importance of fair wages to keep employees motivated. Next principle is degree of centralization. It refers to finding the right balance between decision making at the top level and involving lower level staff. Then, scalar chain. It describes a clear hierarchical communication line from top management to the lowest employee, which helps maintain order and coordination. Then, order. It means everything from people to materials should be properly organized and in the right place. The second last principle is stability of tenure. Focus on keeping employees in their position long enough to gain experience and contribute effectively. Then finally, our last principle is initiative. Initiative encourages employees to think creatively, suggest improvements, and take active roles in problem solving. These principles help build a positive work culture that values organization, stability, and innovation. Coming to the conclusion, healthcare administration is vital to modern health system. It ensures efficient management, policy implementation, and quality care. The principle of administration helps maintain structure, motivation, and fairness. Ultimately, effective health administration improves patient outcomes and system sustainability. So, in conclusion, the healthcare administration is vital part of the modern healthcare system. It ensures that hospitals and clinics are managed efficiently, policies are implemented effectively, and patients receive high quality care. By applying strong administrative principles, healthcare leaders can create structured, fair, and motivated work environments. Ultimately, effective healthcare administration improves both patient outcomes and the overall sustainability of healthcare system. That's all for the presentation. We have discussed about the healthcare administration and the principles of healthcare administration. So, healthcare administration is an important field that focuses on managing hospitals, clinics, and other healthcare organizations. It combines knowledge from health policy, business management, and science to make sure resources are used efficiently. So, that's all for the presentation. Thank you.